First, can you just say and spell your first and last name for me?
My name is Dr. Amy Stone, Amystone.
Great. And then your title, position, and where you work.
I'm an assistant professor of microbiology and immunology at Touro University, Nevada.
Great. So we're here to talk a little bit about this COVID-19 study that you guys are doing and also looking for volunteers. So first, just kind of break down what exactly the goal of this study is and what you hope to accomplish.
The goal of our study is to understand how the Las Vegas metro area and Clark County as a whole have been affected by the virus COVID that causes COVID-19 immunologically. So we're looking at antibodies. And so we want to understand how are the antibodies being produced by our community? And so what that tells us is it tells us a little bit about protection. It tells us about who has been infected, and it tells us about who is getting vaccinated. All of this information can help us understand where we need to put our resources as the public health efforts and lead to hopefully new treatments and vaccines that will help prevent and treat this disease.
And if you can kind of break it down maybe in layman's terms, in terms of once you collect this blood sample, how exactly you go about figuring out that information that you're looking for.
Yeah. After we collect the blood, we bring it into the lab and we separate it into a couple different sections. So first we take out the liquid, and within the liquid are the proteins, which is also where the antibodies are. So that's where we're going to find those molecules that are going to help protect us against the virus. We also are looking at white blood cells. We want to know how the white blood cells are able to function in people who have been vaccinated versus have not been vaccinated, people who have had the disease versus people who haven't had the disease. And what we're hoping to find by looking at these white blood cells is if there's any indication to how we might predict if someone is going to have severe disease or mild disease.
And so it sounds like you're looking to get these samples from both folks who are unvaccinated and vaccinated, correct?
Yes, we are looking to get samples from people who are vaccinated and unvaccinated, people who have been infected and people who haven't been infected. We really need to look at everyone to get a clear picture of what's happening in our community. And so we can't exclude any one of those groups because they are representative of our community.
And if you can kind of explain how it works when you look at these antibodies and you try to decide the efficacy of the vaccines, what exactly are you looking for to make that determination?
So when we take the antibodies, what we're going to be doing is seeing how well they attach to the virus. So we have pieces of the virus that are being targeted by these antibodies. So the virus is kind of like a ball. We've all seen that image. And the parts that are sticking out of the ball, that's called the spike protein. We want our antibodies to bind to that spike protein because that's what's going to stop those viruses from attacking us and infecting us. And so we want to know how well do those antibodies from our community attach to that spike protein, and does that actually stop the virus from getting into someone's cells?
When you
I'm
mentioned,
not sure I answered that fully, did I?
no, you're fine.
Okay.
And earlier you talked about, gathering the information from this study and then determining where best to put resources. So what exactly are those resources that you're talking?
We've partnered with the Southern Nevada Public Health District to share our data. We're looking at zip codes and where people who report either being vaccinated or being infected. From this information by zip code, we can look at where there might be hotspots of infection. And then the public health district can send out the interventions that we need and make sure that people are being protected and making sure that those areas have the clinical workers, the healthcare workers that they need in order to support their community and maintain the health of their community.
And I know currently, within the Clark County area, we have, those current zip code maps, right, that show, like you said, hotspots for COVID infection and then areas that are maybe more vaccinated than others. Is this looking at the antibodies specifically, is this maybe more of a accurate indication? Is that kind of your hope when you do get this data to kind of supplement those existing tools that we have?
Our data will supplement the existing tools that we have that currently show hotspots because our data will be able to show the asymptomatic infections. When you are surveilling a community, typically you're only looking at people who come to the clinic with symptoms. Our group is looking at everyone, whether they've had symptoms or not. And so we'll be able to identify people who had no symptoms but have been infected with the virus. And that will give us a much better picture of the real level of transmission as opposed to just the level of transmission that leads to clinical disease.
That makes sense. And I know you're obviously looking for volunteers. I guess around how many volunteers is ideal, and do you think, if you reach that number, will that be an accurate representation of that population that you're looking at?
We think that around 1,000 participants will be an accurate representation of the Las Vegas metro area. We would always love to have more. More data is always better. And so what we're looking for are just any individual who is an adult over 110 pounds so that they can safely donate blood to come out and give us a small sample of blood. And if we can get 1,000 people, we think that will be a really good representation of our community.
And I see that, the goal is to, publish findings next year. I know you talk about, obviously, the goal of this is to figure out where to put the resources. How important is a study like this? Can you kind of speak to just the importance of doing something like this?
Our type of study is incredibly important for our community. There are similar studies going on all over the world. However, what's happening in other cities such as Seattle, New York, or LA doesn't really represent what's happening here in Las Vegas. And so we need this study from our local community to understand our local needs.
Great. And obviously, you're looking for people over 18. You mentioned weighing at least 110 pounds. How do people get in touch with you guys to be a part of this study?
We're asking people who are interested in our study to send us an email at TUN COVID-19 study, and that's all one word, at gmail.com. That's our study Gmail. After people contact us, we reply with more information. And if they're still interested, we schedule them for the blood draw. We're doing appointments only, and those are going to be at the Southern Nevada Public Health District main clinic that's sort of in the middle of the city on Decatur.
Great. Is there anything else that you wanted to add?
Yeah. Our study is particularly important in this moment because of the rise in cases that we've seen here in August and the rise of the Delta variant. What we don't know from a lot of the vaccines is how long will protection last and how good is that protection against the Delta variant. Our information from this study will be able to give some of that information. We'll be able to test individuals' antibodies against the Delta variant and see, are they protected or are they not? And whether natural infection, vaccination, or vaccination after natural infection will result in good protection. What we really want is to understand, how do we protect our community? And there are so many open questions that really need answered.
Great. Well, thank you very much for your time. I really appreciated chatting with you.
Thank you so much for giving us the opportunity to talk about it and share the information.